Hello guys, this is Vamshi Krishna. Today we will see some of the important questions. So in this video, the first question is an abnormal dilation of wall of the an artery. Okay, abnormal dilation of the wall of an artery is referred as. So when the blood vessel, that is artery, when it is dilated, what is the name of this condition? Options are aneurysm, hernia, atherosclerosis, phlebitis. So the right one is aneurysm. So aneurysm is nothing but the bulging or dilation of an blood vessel. So this is called aneurysm. So the next one is common causes of aneurysm. So what is the common cause for aneurysm? Options are syphilis, atherosclerosis, congenital cause, or any trauma. Trauma is nothing but injury. So the right one is option B. So option B is the atherosclerosis. Atherosclerosis is nothing but formation of fat deposition in the blood vessels, whether it is artery or vein. So formation of fat cells or subcutaneous tissue, the wall of the blood vessel. So for example, if it is a blood vessel, the fat will be deposited here. Okay, so this is the some cause of a common cause for aneurysm. The next one is nitroglycerin is a group of drugs. So nitroglycerin, a drug, is come under the what type of which type of drug? Options are vasodilators, beta blockers, CCB. CCB is nothing but calcium channel blocker, and ACE, angiotensin converting enzyme inhibitors. The right one is option A, vasodilators. So nitroglycerin is a drug come under the vasodilator drugs. So the next question is, an patient is on anapril. Okay, the patient is on anapril and diuretic therapy, and what the nurse she can find that the treatment is not effective. So for example, the nurse is giving a care for a patient, so that patient is on the anapril and diuretic therapy. So how she can understand that the treatment is not effective for the patient? Options are dry cough, skin rashes, edema in legs, and fall of blood pressure. Okay, decreasing of blood pressure. So the right one is option C, edema in the legs. So when the patient is having edema still, that the anapril and diuretic therapy is not effective for that patient. So when the patient is taking these drugs, the edema has to reduce. Why? Because diuretics is work on the kidneys to excrete the excessive volume of water which is present in the body. So if it is not effective, the edema will be present in the legs. The next one is digoxin is a drug. So what is the digoxin drug? Options are CCB, calcium channel blockers, cardiac glycosides, thrombolytic drugs, anti-angina drugs. The right one is option B, cardiac glycosides. So this cardiac glycosides is working on the heart to improve the heart rate, to to improve the heart beating. Okay, to pump the blood from to the body. So this digoxin is come under the cardiac glycosides. So we will see some of the points here. The first one is angiotensin converting enzyme ACE inhibitors are ramipril. So ramipril is a drug of come under the ACE inhibitors, and isertan is a drug is come under the angiotensin 2, okay, type of angiotensin. So the drug is isartan. And the next one is the anti-arrhythmic medicine is amiodarone. Okay, amiodarone. Amiodarone is a drug come under the anti-arrhythmic medicine. And the anticoagulant medicines are warfarin. Antiplatelet medicine is the aspirin. Beta blocker is the bisoprolol. And calcium channel blocker is the amlodipine. So these are the categories of drugs which are come under the cardiovascular system. So the next question is, a physician ordered heparin infusion. Okay, the doctor has ordered the patient to give the heparin infusion to the patient diagnosed with the DVT. DVT is nothing but deep vein thrombosis. Okay, so in the deep vein there is a clot. Okay, whether it is a fat embolism or a blood clot of the blood RBC, okay, that is called thrombi. And the nurse remember which of the following drug is should be available. So when the nurse is giving the heparin infusion, so which drug she has to be keep in ready? Options are vitamin K, warfarin, protamine sulfate, calcium gluconate. So the right one is option C, protamine sulfate. Why? Because when we are giving the heparin infusion, they may have the risk for overload of heparin. So to reduce that, we have to keep keep in ready for protamine sulfate drug. Okay. So when there is a increasing of heparin overdose, immediately we have to give the antidote for the heparin, that is protamine sulfate. The next one is, when a patient in ICU needs CPR, which of the following code is need to call emergency CPR team? Options are code red, code blue, code black, code pink. The right one is code blue. So code blue is always related to the cardiac arrest. Okay. And the code red is for the fire. And the code black is the a bomb blast. Okay. When there is any bomb blast in the hospital, the code black will be announced. And the code pink is when the children is missing in the hospital, that is come under the code pink. The next one is, during the CPR rescuer, give breath for how much time? So we are doing a CPR for the patient, some person. So in how much time we have to give breath for that person? Options are 6 to 8 seconds, 10 to 15 seconds, 20 seconds, 25 seconds. The right time is a 6 to 8 seconds. It is just around the below the 10 seconds we have to give the breath, and then we go for the compressions, chest compressions. The next one is, according to WHO, which is not included in surgical safety checklist in OT, operation theatre? Options are sign in, sign out, time in, time out. The right one is time in. So the time in is nothing but the persons who are entered into the OT, they have to come under the sign in. Okay. And when they leave the operation theatre, it is come under the sign out. And time out is included in the sign out. When you are going out of the hospital, out of the operation theatre, you have to write the time. And when you are entering into the hospital, you no need to write the time, which time you enter into the OT. So according to WHO, the safety checklist in the surgical operation theatre, the time in is not included. The next question is, effective CPR includes. So when we can say the CPR is very effective for the patient? Options are respiratory rate 20 to 24 beats per minute, chest compressions 100 to 120 per minute and allow complete chest recoil. Option D is the 5 to 6 centimeters of depression. Depression is nothing but that how much compression we give for the patient by our palm. So the options are, option A is the A, B, C and D. Option B is the A, B and D. Option C is the B, C, D. Option D is the A and B only. So which one is the right answer? When we can say the CPR is very effective, so understand these four options and put the correct answer. I hope you understand this question. Okay, when we can say the CPR is effective. Okay, the right answer is option C. Option C is a B, C, D. B, C, D is referred to as the CPR is effective. Okay, why? Because compression should be 100 to 120 per minutes and we need to recoil the all the chest. Okay, and the depression must be 5 to 6 centimeters, but the respirator rate is not 20 to 24. The respiration rate is it is just around the 15 to 18. Okay, so then only we can say that the CPR is effective. The next one is a patient who was on ventilator and being ventilated for past few days. Suddenly the patient pulls out the endotracheal tube. What is the next step of management? Okay, understand the question. It's a practical question and think. So when the patient is pull out the endotracheal tube, so next minute what we have to do as a medical professional? Options are, we need to re-intubate the patient, otherwise oxygenate and re-incubate and start CPR, otherwise watch for the spontaneous breath and re-intubate if needed. So what may be the correct answer? The right one is option D. So option D is we need to check for the spontaneous breath. That is nothing but whether the patient is taking breath or not. Then if it is possible, go for the re-intubate. But you should not start the CPR. If you want to start the CPR, you need to monitor, you need to look at the monitor. Okay. So in the monitor we can see the heart rate, respiration and everything. So then only we go for the CPR. And saturation, when the saturation is down, we need to go for the oxygenation. Okay, if it is not maintaining, we will go for the re-intubate. So firstly we look at the watch for the spontaneous breath. So this is the right answer. Option D is the right one. The next one is the following electrolyte change. Okay, following electrolyte change in digoxin toxicity. Digoxin toxicity is nothing but overdose of digoxin drug. Options are hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia. The right one is hypokalemia. Okay, hypokalemia is nothing but decreasing of potassium levels in the blood. Why? Because the digoxin is combined with the potassium. So the patient will have the hypokalemia. The overdose of digoxin toxicity can cause for the hypokalemia. The next question is immediate treatment for ventricular fibrillation. So here the question is a ventricular fibrillation. Fibrillation is nothing but abnormal ventricular contractions. Okay, there is no systematic rhythm. Okay, we cannot find the systematic rhythm in the ventricular chamber. So that is called fibrillation, abnormal rhythmic movements of the ventricular, that is called fibrillation. And what is the immediate treatment when the patient is having under in the ventricular fibrillation? Options are adrenaline, defibrillator with 360 joules, cardioversion, antiarrhythmics. Antiarrhythmics are nothing but the drugs which prevent the anti arrhythmias. Arrhythmias is abnormal heartbeat. So the right one is we go for the defibrillator. So the defibrillator will give a shock wave for the patient in the condition of ventricular fibrillation, that is immediate. Immediately we need to go for the defibrillator with the 360 joules. 360 joules is nothing but the percentage of the shock how much we give for the patient. So identify the instrument below showing. Okay, maybe you have seen the hospital. This instrument mainly is available in the emergency room and intensive cardiac care unit. Okay, what is the name of this instrument? Options are pulse monitor, defibrillator, CPR machine, pulse oximeter. So which one is the right answer? Put in the comment box. So I hope you all understand these questions. Okay, thank you guys for watching.